We have the definition of aquatic physical therapy, that is a special practice of physiotherapy with therapeutic intent toward the rehabilitation or attainment of specific physical and functional goals of individuals using the medium of water. The main benefit of aquatic therapy are two. The first one is a positive influence on social interaction, behaviors and participation and levels of children with neurological damage. And the second one is an improvement in motor symptom and increases physical activity, and these levels are maintained 6 months after the conclusion of the program in children with developmental disorder or automotor disorder. The aim of the study are two. One is identify intervention categories encountered by aquatic physical therapists working with children with neurological disorder and musculoskeletal disorder. Concerning neurological disorder, we can find three principal disorders: central and peripheral neurological disorder, psychomotor delay, and autism spectrum disorder. And the second aim is to summarize this concept using the ICF framework. The ICF is a classification that enables the description of changes in body function and structure, considering the level of capacity and the level of performance in children. And this is a chart that shows how the classification is structured. Concerning method and study design, we have that aquatic physical therapists have described the concept related to the functioning of disabled children and their contextual factors. The data were collected in 3 rounds using the Delphi technique, and all answers were translated to the ICF and analyzed to determine the degree of consensus. In this study, they consider only the categories that obtain a consensus of 80% or higher. Concerning study design, is a cross-sectional study. Conduce use 3-round open internet survey based on the Delphi method. The Delphi method is a technique used to find an answer to a problem from a group of experts for 2 or 3 rounds. Concerning participants, 15 are authors of article, 97 took part to an international courses organized by the Association International Aquatic Therapy Faculty, and 53 were experts provided by the World Confederation of Physical Therapy and Aquatic Physical Therapy International. Inclusion criteria are that they had to be qualified physical therapy, work in APT with children, and have over 2 years of experience treating children with neurological disorder, musculoskeletal disorder, autism spectrum disorder, and psychomotor delay. And the participants are able to communicate either in Spanish, English, or Portuguese. At the end, 98 participants have agreed to participate, and among them, 69 therapists are included in at least 1 round of the Delphi exercise. Concerning data collection, we have that they organize 3 rounds. In each round, the questionnaire was sent by mail to participants with also the instruction. And the first questionnaire requested therapists to provide a list of body function, body structure, activities and participation, and environmental factors that they consider to be influenced by APT intervention. The second questionnaire included a summary of the first questionnaire and also details regarding if the participant had named each category and the corresponding percentage. The first questionnaire included identical ICF categories as Delphi round 2, and also give information about individual participant answer from round 2. And also filling groups responses from round 2 from the corresponding group. At the end, the data of the categories that had not reached an 18% consensus were presented. Concerning results, we have that body functioning component only 4 categories obtain a consensus of a percentage or higher, and throughout all 4 groups. And this category are partner function, proprioceptive function, mobility of jaw, and muscle tone. Considering body structure components, we have that a single category obtain a consensus throughout all 4 groups, and this category is structure of trunk. Concerning activities and participation component, one category, that is changing basic body position, obtain a consensus of 100% in all 4 groups, and 3 categories obtain a consensus of 18% in 4 groups, and these categories are maintaining a body position, transferring oneself, and walking. Regarding environmental factor components, the responses were divided among the factor to be influenced and the factor that influence the therapy. Concerning factor to be influenced, we have the 2 categories that are immediately family and individual attitudes of immediate family members, obtain a consensus of 18% or higher throughout all 4 groups, and only one category of the influencer factor obtain a consensus in 3 groups, and this category is individual attitudes of immediate family members. These are the table that show the total results. Here we have body function, the corresponding categories, the percentage of consensus, and the health condition. We have activities and participation, environmental factor, and influential environmental factors. So in this study is the first to use the Delphi technique to identify the most relevant area of intervention in APT using the ICF structures. Body function and activities and participation are the components where more categories were found. And movement categories is the categories that obtain the highest consensus. And this result coincide with a study in which aquatic therapy performed in children stabilized the progression in the lower limbs of spinal muscle atrophy type 2. And in all 4 groups, categories referring to mental function and its involvement in learning were underlined. And also these results coincide with a prior study that show how aquatic therapy helps improve some aspect in children with autism spectrum delay and cerebral palsy, aspects such as attention, social behavior. In conclusion, this study highlights the variety of intervention categories available to aquatic physical therapists when treating children in the water.